safety of London Ambulance Service in the name of Murad Qureshi.
Thanks, Murad. This is a question, I think, arising from the Care Quality Commission study, I think just before Christmas, which did give rise to some concern about what was going on in the LAS. I mean, the key, I think, all our personal experience of the ambulance service is that it is fantastic, and I would just remind you that the LAS reaches 75% of patients with life-threatening conditions in 8 minutes. They exceed their target every year, and they're up to 79% in December. They are working to improve their service to rectify any shortcomings that the Care Quality Commission may have identified, but they are, by comparison with other ambulance services around the country, doing a fantastic job and spend a huge proportion of their time, comparatively speaking, with patients.
Thank you, Mr. Mayor. My concern is the reality that A&E pressure is going to mount across London and the impact on the London Ambulance Service, particularly in light of the potential that we have 8 A&E closures in London. We may hear tomorrow about one of them. We've also got a population growth in London that your planners know very well about, that of London's population going from 8.2 to 9 million. And that population is also getting older. But there is an expectation that the London Ambulance Service will take up the slack in moving patients around. They themselves are having to make £53 million worth of savings, losing 890 staff, of which 590 will be frontline staff. Can I just be very clear? What representations have you made or are going to make about the findings of the Care Quality Commission, which you have read now, that the LA is dangerously understaffed? Dangerously understaffed.
Yeah, I mean, the impact is, even in the CQC's own judgment, is not severe. As I understand it, what's been happening is that they are working with the North West London NHS Trust, which runs the LAS, to see what they can do to address the problem. They have had, I think, an additional £6.5 million to meet the particular stresses of this period, and I'm certainly content that they are seized of the problem. And are addressing it. But I have to say, you look at the results, you look at people's actual experience of the LAS, it is fantastic.
I'm not here to knock the the London Ambulance Service. I'm here to express concerns about whether they've got the resources to meet the growing demands on them. And there's another level where we do need representations. This time actually from the Daily Telegraph.
Yeah, sorry, I should have told you that Victoria met Anne Radmore, the Chief Executive, on the 23rd of January to discuss the point of making.
Okay, well, I'm glad to hear that. I'm also keen to hear that you're going to make representations about the concern about the decision made by London Ambulance Service to pay bonuses to control room staff and not to send ambulances in responses to calls, as reported by your employer, the Daily Telegraph. They're not going to send ambulances in response to calls. They're getting bonuses for that in the central control room.
Well, I think there may be a slight confusion here, Murad. As I understand what's happening, is that there is an attempt. I mean, obviously, a lot of ambulances get called out to events that don't, strictly speaking, require an ambulance, and I think there is an attempt to try and reduce this number by having a better clinical appreciation of what is really going on. I think that's what you're describing.
Well, it was reported by your employer, the Daily Telegraph, and I do think it needs to be warranted and taken seriously. We may have an opportunity next week at the Health and Environment Committee to ask that. I'm just interested in whether you, as Mayor, have made those representations already.
Well, we've made representations about the LAS and to make sure that they feel that they're properly staffed and properly supported. But I think what you're talking about is an attempt. There's a team of paramedic clinicians and call handlers who are now in the control room, and their job is to to review requests, particularly police requests, and to call patients back in order to check out, to make a preliminary clinical assessment. And we all have experience in our families of perhaps events where an ambulance has been called when strictly speaking, maybe it wasn't necessary. And if you can reduce such call-outs, obviously you will reduce the burden on the service.
Well, I'll ask Victoria after this meeting what representations she's made to the ambulance service on that front. Can I also ask whether you've made representations, again coming from the Care Quality Commission report, that the London Ambulance Service doesn't have enough equipment to promote care and welfare of people using the service?
I don't know whether that is the case. I've no information that they're under-equipped. But if that is the case, it's certainly something that we will take up.
Well, it sounds as though maybe Victoria should have been sitting there in response to this question.
Well, as you know, I don't run the London Ambulance Service,
I think the critical thing is,
we don't have responsibility for healthcare budgets. But we are certainly representing the wishes of Londoners in making sure that the service is kept up to scratch, and indeed it is currently performing extremely well.
My concern is actually the London Ambulance Service after April may be the only pan-London NHS service that we've got, and it will be taking up a lot of the stress through these potential A&E closures that we're going to hear about from tomorrow.